Trail with my best friend, Macy. And we're here to talk about health and what you can do in these tough economic times to make sure that you take control of your own health. Part of the things we can do is partnerships. Partnership with your job, partnership with your community. Get out there and take a look at what we have. Health doesn't have to be expensive. It can be something as simple as taking the dog for a walk or going for a stroll on Discovery Trail.
Oh, good kick, Ryder. Excellent, excellent. Go get it again.
Just about a year ago, we had the fortunate idea of having Pacific Sport come into and share our building here at ARC, and so we worked together on a number of different projects, but right now we are specifically working on bringing physical literacy to the community of Abbotsford and incorporating it into the programs here at the Abbotsford Recreation Centre and throughout our parks and recreation programs.
All right, let's knock those balls down. Physical literacy is an outcome that builds foundation for movement skills such as throwing, skipping, and swimming. Now, for example, the soccer program, it incorporates kicking, throwing, and running, all those skills that are transferable to any particular sport or physical activity that the children can then play in to become active for life. Some other benefits of physical literacy include an opportunity to develop life skills such as teamwork and goal setting, and it also helps build confidence.
For my son, I really enjoy that he can come here, learn some structure, as well as be active. Starting him young, 3 years old, playing soccer, I think that could grow into something, teach him how to play with other kids, teach him how to be a team member, and he enjoys it.
Another partnership that exists in the city of Abbotsford is the partnership with SCOPE. SCOPE is a project that works with the community to develop cross-sectoral partnerships that promote and support children in achieving a really important health message called Live 5210. 5210 stands for at least 5 vegetables and fruits per day, less than 2 hours of screen time per day, at least 1 hour of physical activity per day, and 0 sugar-sweetened beverages.
All right, let's knock him down.
The partnership between ARC and Pacific Sport is a perfect example of how community sectors can support children in achieving the 5210 by providing them with the skills that they need to be physically active for their entire lifetime.
Okay, so we just talked about partnerships for community health. Another examples would be, community health screening. So I know the health department gets involved. The city of Cincinnati holds a blood pressure and diabetes screening with a bunch of different businesses that help support it. Local churches will have cooking classes for diabetics. As well as some local restaurants. A healthy community usually means a healthy economy for a community. So that's really something else that's important. And then also partnerships for community involved, places that help with job finding, with job training. The United Way is a national one, but there are smaller community partnerships, places that are willing to hire people who've been rehabilitated in the prison system. Schools, of course, are a big part of that. Okay, so goals and means of community-oriented practice. So the goal, the nurse and the community seek healthful change together. So, it's not just about the patient now, right? So when we talk about setting goals in nursing, we talk about stuff with the patient. They need to be able to walk up X amount of stairs before they can go home. They can do the insulin spirometer without prompting for 4 days straight before they can go home. Those are examples of individual nursing goals. When we think about the nurse and the community seek healthful change together, getting a 90% immunization rate on vaccine preventable illnesses, Tdap, polio, MMR. Making sure that everybody above the age of 45 has been screened for diabetes at least once in the last 3 years. Making sure that everybody's been screened for high blood pressure after the age of 18 in adults. So community health has three common characteristics: status, structure, and process. So status, that involves the physical things, so morbidity, mortality rates. So one thing that lots of communities look at are infant mortality rates and compare it to the national average. And so looking at that and seeing what the community status is and how can we improve that. So in the city of Cincinnati, we had a really high infant mortality rate 10 years ago. It was higher than the national average. So the health department partnered with the community to talk about ways to change that. And through exhaustive study, epidemiology, they found a few causations. One of them is spacing between pregnancies. There wasn't enough spacing between pregnancy for many women. They were getting pregnant too soon. And so they implemented a long-term birth control program, and that helped a lot. Also, there was quite a large incidence of SIDS or death from lack of safe sleep. So providing cribs and safe sleeping surfaces for anybody who needed it in the Cincinnati Health Department. And then part of it was just prenatal care. There was just such poor prenatal care and also postnatal care. And so increasing that access to that. And overall, now we're below the national average for infant mortality. Emotional, so client satisfaction. Are patients getting in on time? Are they able to see their doctor on a regular basis? Are they satisfied with their care? And obviously, we all talk about patient satisfaction. We all, you see those memes on Facebook where you just kind of slap your forehead like, oh my gosh, who cares about my Press-Gini scores? But this is more to the point where someone, you're surveying, do you trust your provider? Do you see a consistent group of people? Is, the community health setting stable? Do you trust them to go in and see them when you have a problem with drugs, when you have a problem with gangs, when you have a problem with pregnancy, STD? Are you satisfied with what's being offered to you? And then social components, crime rates, and that plays a big part of it. Crime, the healthier the community, the lower the crime rate. And with or without statistical analysis, that's a pretty, at least anecdotal thought process. So, for example, when you live in a poor community, you're going to see higher crime rates, and that's also linked to lower health status. So, that's part of your community assessment and status. So, structure, services, and resources in the community. What kind of services are there? Are there walk-in STD clinics? Are there community health clinics that provide primary care, prenatal care, reproductive health, such as birth control? Pediatrics. Do we have home health for those who can't afford it? Is there a council for aging to help those who are aging? Because that is just a whole different area in itself. What kind of school systems do they have? Do you have alternative schools for those who don't necessarily fit the mold of the typical high school student? Are there resources for those who are trying to get drug and alcohol rehabilitation? Inpatient versus outpatient? Are there homeless places? Are there halfway houses? Are there mental health facilities? And that's a big one where most communities find a gap. Are there resources for gay, lesbian, and transgender? Again, another area where communities tend to have a gap. And so what kind of structure is there to reinforce the overall health of the community? And then the process, effective community functioning and problem solving. So do we assess the problems correctly within a community? Do we pinpoint what areas need help, what areas need improvement, reinforcing? Where are we successful? And then how do we solve these problems? So Healthy People 2020 talks about overall community health goals, right? So lowering infant mortality rates, lowering diabetes rates, improving, what else does 2020 talk about? Improving drug and alcohol rates. So looking at that goals and seeing if your practice is oriented toward reaching those goals. Having community partnerships, we talked about that. And then strategies to improve community health together. And there are a lot of different programs, and I will post some of the guidelines for Change, MAP, Patch, Apex Page, and Community Guide. And that will be a really cool area for you guys to look into. So community-focused nursing process from assessment to evaluation. So assessing community health. So data collection and interpretation. So how are you going to collect data and how are you going to interpret it? What type of mechanism are you going to use? And then how are you going to gather data? Are you going to use community health workers? How are you going to train them? Data generation. What process are you going to use to spit out the data? And then what kind of database analysis are you going to use? So there's collection of direct data and collection of reported data. And direct data is stuff you collect and then see exactly and measure exactly, so people's blood pressures. Reported data is data that you get from other sources, so maybe blood pressures from other community health providers, blood pressures that are taken from a church blood pressure screening. And I keep bringing up the church blood pressure screening because I just worked one the other day. I'm not trying to keep enforcing that. And then community reconnaissance, that's that windshield survey. Going around the community and seeing what resources are available, what is the overall health status, what are the status and structures of the community. And then what kind of assessment issues do you have? Is it a safe enough community for you to go out and look at? Are people willing to share information? So that's kind of the idea, the components of an assessment for the community. So you want to identify community problems and then planning the community health. So you analyze the problems, prioritize the problems, establish goals and objectives, and then find interventions. All right, so implementing for community health, factors influencing implementation. So funding, that's a big one, right? I mean, a lot of our projects have to come from grants because even when a city wants the community to do well, a lot of times the priority won't always be put on health. So an example of that, Cincinnati Health Department, we are part of the city of Cincinnati, and our funding is not always where it needs to be. And that's not, I'm not trying to say, oh my gosh, they have their priorities screwed. We have a really bad crime issue, a really bad heroin issue. And although, crime and heroin are in the purview of health as well as police and fire, what's most important at this time, because we are in acute crisis, is making sure we have enough policemen and firemen in the street, right? And so at least from the standpoint of politicians, that's what they see. They don't necessarily see that the overall improvement of health might lower that need. And that's not to say somebody's doing a bad job. It's more to say that's how priorities are looked at. Not everybody sees health as the number one priority. We see that every day with our patients. When you say you need to take your medicine on time, you need to make sure you pick up your medicine from the pharmacy, and they say, well, if it's between that or paying for my kids' medicine, or paying for my kids' school books, or providing food, or going to work. We get a lot of truck drivers who say, I can't take insulin because I can't drive my truck. They don't really quite understand that, well, with uncontrolled diabetes, they won't be able to drive their truck. So, take the insulin now and wean yourself off insulin once you get yourself healthy. That sort of idea. So, factors influencing implementation. Budget is a big part. Crime is a big part. When a community is just overwhelmed with crime, it's really hard to implement new ideas in a community. People are scared, resources are scarce, and priorities are not focused on health. Language barriers plays a big role. So, we have a big Nepali community in Cincinnati, and as of now, none of the local providers speak Nepali. So, that plays a big role. Literacy, that's a big role. I mean, if you can't read, or if you don't have healthcare literacy above a certain stage, it's hard to implement, chronic care management. So our nurses, our role is to be involved with the social change process, getting involved with budgetary issues, trying to find grant money, trying to make it a priority for the city, trying to encourage parents that, yes, you need to focus on, yes, like you don't have a lot of time to cook dinner, so going through drive-through seems easier, and at least you're feeding your kid, but, trying to find a way to take the time to cook ahead of time for your family. So that's the nurse's role, is helping change the processing within. And then evaluating the intervention for community health. Again, part of the role of our registered nurse is evaluation of an intervention. So what is your role of the outcomes and evaluation phase? So your role is to evaluate the intervention. And then also next steps, right? Maybe an intervention didn't work. What do you have to analyze to make something work? What went wrong? Where can you improve the next time? Or was that intervention not appropriate for the community? If something did work, how can you make this sustainable, right? I mean, it's one thing to improve everyone's diabetes when you have a grant and you have all these community health workers helping you, and you make a cooking class and a grocery trip class and an exercise class, and then that grant money runs out. So how do you keep that sustainable? How do you get other community resources involved to make this intervention sustainable? So that's part of our role. And then personal safety in the community. So it's always a consideration throughout the process, and it's a prerequisite. You have to be aware of the community and use common sense. So, for example, we have tons of home health nurses who go out into the field day in and day out, and they are just amazing, teaching people, increasing health literacy, medication management, finding ways for people to manage their health at their level. But if the environment that we're sending them into isn't safe, then they can't go in there. That's not appropriate, right? Because you're going to hurt the nurse, and that nurse can't reach out to all the people that they touch. So you have to be aware of the environment. So talk to other nurses, the social worker. The social worker might say to you, listen, I think it's great you want to send home health there, but honestly, there's a lot of gun violence. We know for a fact that there's some drug dealing going on in that house. It's just not a safe environment. Maybe they can meet at a friend's house, right? Talking to other community members. Hey, I'm going to this section of town. What do you think? And saying, okay, well, we really want home health nurses in here, but they need to be escorted by, police. Okay, great. And then your own observations. You're sending someone, you're going into someone's home. You say, I'm going to come and do a home assessment to make sure that you and baby are going to have a good transition from the hospital. Well, if you observe that, there's safety issues and concerns in the house, they talk about firearms, they talk about drugs in the house, they talk about just abuse in the house. You have to be cognizant of that. And of course you want to offer care, but you might have to find a different way to offer care. Alright, so that's it for chapter 12. We are going to pick back up and talk about chapter 13 and 14.